Good evening. You're welcome to another episode of Early Intervention Matters podcast. This is a platform where we discuss different issues relating to neurodiversity. And I'm Dr. Inyang Takon. I'm a consultant neurodevelopmental pediatrician. I'm based in the United Kingdom. And we've been going on this podcast for the last 5 years. So today I'm really pleased to have a great guest with us. She's Lynn Banis, and she has a lot that she's going to be sharing with us today. I'm very pleased and excited to have Lynn here. Thank you, Lynn, for accepting to come on our podcast. We're really looking forward to the conversation with you, and we hope that our audience will be able to get some good action points today because I certainly reading through your profile and the work you do, I was super impressed.
Well, thank you, and thank you for having me on. I appreciate that, and I'm hopefully I can shed a little light on some things people might have questions on.
Thank you. So for our audience, I met Lean on Podmatch, which is a podcast platform that myself and Lena on, and I was struck by the resilience in her journey. And that's part of what we're going to be talking about today. And some people might be wondering, oh, resilience and neurodiversity. I think that we would, by the end of this podcast, would really understand why this was really important. So I'm just going to let Lynn talk a bit more about herself and introduce us and tell us a bit more about what she does and what led her to what she's doing. So Lynn is a grief and resilience mentor.
Yeah. Unfortunately, you have to have gone through it to really understand the depth of it. But my professional life before I retired was as an executive coach in a big financial services firm. So I had the opportunity to go all over the country and work with partners to help them with leadership behaviors and help them with issues, communication, all that kind of stuff with their staffs. So I have been a coach since before coaches were coaches. I have a doctorate in organization behavior. And so I have helped people be the best they could be for years and years and years. And one thing that interested me is talking about neurodiversity. I have a nephew who is in that situation, and I have watched my brother and sister-in-law and their children, they have two other boys, do the raising, and I understand a lot of the issues that they have to deal with, so that's hard. And I really think that what I do around grief and loss, and it's not just grief, I have, moved into all sorts of loss because it puts you in the kind of a grief response. So you lose your job, you lose your best friend, you lose somebody in the family. All of that stuff takes our identity away.
I guess.
And when I stop and think about parents of a child who's neurodivergent, that happens. Here you are as an excited parent about to have a baby, and you have all sorts of wonderful thoughts about what's going to happen and so on and so on. And then all of a sudden that's totally gone. That's totally changed. And so no longer do you call yourself a parent of children or a child. Now you're a parent of a different kind of child, and your visions of your future
Mhm.
have to change. That can be so hard, so difficult. So what I do is I help women through the grief process, as well as helping them find out who they are underneath it all. What have they taken on that's really not theirs to take on? How do we get rid of that? What are the self-limiting beliefs that they tell themselves that kind of keep them from seeing things as they really are? And how do they find out what's important to them when here they are being asked for all this support of a child? They don't have time for themselves. They don't think about themselves, but that's detrimental in the long run. So how do you balance all of that and complete rounded individual in your own right, but
Mm,
also protect and care for the child
mm,
that you're responsible for.
absolutely. Yeah, and I think you've just said it very well in the sense that a lot of the families I see, because I do assessments and diagnoses. So I'm usually the person after the assessment that has to break that news to them. It's usually a very difficult time,
Yeah,
especially if they haven't been prepared for it. And some of them have gone through periods of not wanting to come to terms that there are differences in the child. And so for some people can stretch that journey for as long as they can. So at the point where you're giving the diagnosis, you get different responses. And sometimes it's just a period where they go through, like you say, just I've had a parent say to me after the diagnosis that, but why did this happen? It was fine when he was born. Where did it come from? I could see the frustration and the anxiety. And it's very difficult for us because we are in the clinic setting at that time,
mhm,
and you just cannot help them process or begin to process that. It's like grief. It's definitely it's a loss because the parents are walking through what's the future. I always get asked that question. So is it going to go to school like everybody else? Is it going to go to normal school? That's what they say. It's going to go to normal school. So when is it going to start doing X, Y, Z? And there are questions that many times I can't answer and give them specifics.
of
So
course.
they get frustrated. And so going through your story of grief, it's just a loss. It's a big loss for families.
Oh, yeah.
Yeah. So
It's it's terrible, and it leads to chronic sorrow because there's no outlet for them to release that. It just over and over
yes,
every day they wake up and it's still in front of them. You know, as a physician that if we don't treat stress, that we get sick, we get emotional and psychological issues and all sorts of things. So I see a huge issue where parents are so busy taking care of their child they don't take care of
yeah,
themselves. And it's back to that you can't pour from an empty cup. If you're empty, if you're exhausted all the time, blah,
yeah,
blah, blah, you cannot give what
yeah.
needs to happen.
It's true. It's definitely true. So at the beginning, when I read you had successive losses, one after the other. That must be very hard.
It was extremely difficult. And I can, in some ways, I can relate to a parent getting that diagnosis because here I am. My mother was 106 when she passed.
Mm,
So that's one of those things where it's coming, but you don't. And you don't know what that's like. But then before I could even get through any grieving, my little brother passed away in the middle of the night. And then my husband passed away from complications with surgery that just never should have happened. So here are these three very, very close relatives who all of a sudden are gone. And jokingly, I say, I think stress or loss is the wrecking ball of life
mm.
because here you are one day going along, doing your thing, just being you and anticipating the future. And then boom, within no time at
It's gone.
all gone. And there you are. And we get stuck in the it's all gone, particularly at first when it's so emotional.
Yeah,
And we need to find somebody that can help us walk through the process of dealing with all of that and get to the point where we look at it and say, "Okay, so this is what it is. We can't change it. How do we make it the way it will work for all of us?"
yes,
And so that's essentially what I do with my clients, and I help them into creating their new chapter of life. They have a lot more leeway in deciding those things
mm,
than your parents do. They've got a lot of boundaries they can't cross because of
mm,
responsibilities.
Yeah,
So it's
it
really
is.
important to get clear on what they have control over and what they don't,
Yes.
and kinds of decisions they can make and things that they can do. But what happens to us is our brain kind of shuts down. Well, not kind of. Our brain shuts down, and we lose our ability to look at possibilities and options.
Mm.
So we kind of get blinders on. This is the way it is. It's terrible. It's never going to change.
Yeah.
And so being able to work through the belief system that we have around all of that
Mm.
is really, really important.
It is very important. And I lost my younger sister during the COVID, uh, that which was quite hard because she was very close to me and she was somebody I spoke to on a daily basis, sometimes driving to work and just calling her because she was in another country. And then all of a sudden, for somebody who wasn't chronically ill, one minute she's fine in the morning, and the next thing I'm told she's gone. And like you said, it's like somebody's just thrown a wrecking ball at you. And those emotions are something that is very difficult to put in words because it's almost like everything is shut down.
It is.
So have a window to what it must be like for families when they've got the diagnosis, and for some of them who've been so expectant and thinking about things, and then suddenly this happens, it can be very difficult.
Absolutely.
Yeah.
Absolutely. And I think that we need to be very careful how we interpret that, label it, whatever you want to call it, because these parents have this kind of grief that is ambiguous. They don't know what's coming. They just know it's there. They can't really name it right away in any way that makes sense to them because, as we said, their brain has just pulled back and
Mm,
it's trying to adjust, which means that it can't think clearly.
mm.
And we know when there are a lot of high emotions, there's no way we can make a rational decision about anything. So we end up focusing on our emotions then.
Yeah, it's true. So how did you at what was the turning point for you?
Well, I'd really retired when mom came to live with us because I knew that was going to take a lot of energy. And I have a daughter that's a BCBA and, specialist in autism.
Mm.
She's treated children for a long time and really worked with the parents too. So,
Mm. So where is she working?
well, now she's gone with the healthcare system, but she was working with private practices prior.
Okay. Is she enjoying it?
She loves it. She loves it. Every time she has to let a patient go, she just cries and she gets awfully involved, but it's a healthy involvement. It's not, yeah.
Yeah.
Um,
I think when you work with children in this field, you become very passionate and protective of them, and you want things to work. You're almost there, right? And so I see where the drive comes from. Once you do it, you see the world from a different view.
I'll say I worked in 2 children's hospitals, so
Okay.
yeah,
Yeah. So, Liv, yes, we've talked about how parents of children with neurodiversity experience similar loss. And what do you think? So, for those parents, I mean, I would say probably there are different groups of parents. There's some parents that would get into that almost like shock like state.
sure.
And some parents might just want to keep doing things because that child has needs. What would you consider in those stages? Are they still grieving? And, what?
I think that yes, because grief has so many different aspects to it. And some people are probably in the state of denial right away, or they just go on autopilot. They've got to get this done. They've got to get this help for their child. They have to do that. They have to do that. And so they are just going and going and going. And there is no time for them to stop and think about themselves. And I saw that with my brother and sister-in-law. My sister-in-law understood immediately. My brother had a really hard time accepting, and they had to deal with that as well as what was going on with their child.
Yes. And sometimes you find that two people in the family almost grieve differently, and that pattern can be different. And it brings us to the point of even when you lose somebody physically. So during the COVID time, I couldn't go to attend my sister's funeral because there was all this embargo and, had to watch it on the screen, which was even harder. It was just horrible because couldn't travel and it was really bad.
Yes.
And then I lost my mother 2 years ago and I had to travel for her funeral. But from the moment, because she was ill about a month before she passed away, but you almost were going on an autopilot,
Yes.
even though you knew something was going on. And even when it got to the funeral, because you were so engrossed with just getting things done. And I said to somebody that it took me almost a year to actually properly grieve.
And
And
that's pretty fast, actually.
yeah, I mean, to become, it's still, there. It's still something that stops me in my tracks and everything because you suddenly realize this person is not here. But because of all the activities that were going on, you didn't really have time to have a moment to yourself to go through those processes. And I think that's what happens with some of our families with who are with neurodiverse children who've been given the diagnosis.
Mhm.
It's that they keep going, keep going. They've not really had time to be aware of themselves and all that.
That's right.
Yeah.
Yeah, and it's a very important thing. In order to reach a turning point where you can see all of this differently, you have to honor that grief before you can get to a turning point. You can't bypass it. There's a children's a little silly song about a bear going someplace, and the little song says you can't go over it, you can't go
Don't go
around it, you
under
can't
it.
go under it, you gotta go through it. Um, that's what this is. They have got to go through the grief, but there's no time. And
Mm,
so, if they can pay attention to that and get through the grief, then their perspective or the context in which they see a child often changes from this is a person who has a problem or a child that has a problem and they're not really like the normal child is. You can get to the point where you say, no, this is normal neurodivergent behavior.
mm,
And when that shift happens, then there's genuinely a transformation where that acceptance kind of gets in bones and it's like, okay, let's look at this differently and let's see what we can anticipate in the positive
mm,
vein for this child. Have you
yeah.
seen anything like that happen?
Yes. And sometimes the duration of that journey can take a while,
Yeah.
especially when there are lots of things they're going through and when things are still quite active. Sometimes parents might struggle to see even the small changes, the small positives. They just struggle, they don't say it. But it's quite far away. They're just not able to get to that point of acceptance. So they get there at different levels.
Yeah. Yeah. And actually we're in the fight or flight response. I got to take care of this. I got to beat this. I have to get this and I have to get that. So most people go there. Some go to the flight. I'm out of here. You see that happen with parents. Sometimes one of them will say, I can't deal with this.
Yeah.
And then that's so much harder on the person that stays. They have
Yeah.
so much on their shoulders. But
Yes, I've had that as well, where all kinds of crisis comes after because the other person is not able to handle the stress. So, Lynn, when you were going through this and working through this, what was the turning point for you? Because it was quite heavy for you to lose three very close people.
it was. And I did what many people do and what I caution my own clients not to do. And that is, I looked around and I thought, this house is too big. I cannot handle a big yard, a pool, 5 bedrooms. I can't do it. So I went through the process of selling my house and buying a smaller one, which the reason I would suggest to my clients not to do that is that you're still in that brain fog, and you could get in a situation where you ended up moving to something you didn't like or that wasn't suitable or in the neighborhood or whatever. It's really important for us to be able to take that time to grieve, but I didn't. I pushed, 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 pushed. And guess what? My body said, knock it off. And for 3 months, I had one thing after another. And the good part of that, and what became the turning point, was that I had time to think. I was in bed a lot of that time, really ill. And one morning, I finally woke up and thought, you know what? What are you doing? You have all of the skills and knowledge that you need to help people through this. So let's get this done. And so I really worked on myself. And then I was able to take the tools that I used for myself and create something for other people that helps them get through the process.
That's fantastic. That's really good. I read all the things you were doing and I thought, wow, it's very impressive. So there was something that had to give you that period to actually have, because you had that break, wasn't it?
I was forced. Yeah.
Yeah, that's what I wanted to say. You had that break because you were forced.
Your
If not, you
body's
would have
just not
kept
going off and
going.
it means it.
Yeah. So if not, you'd have kept going and going and going and never really had the time to confront what was
Yeah.
there.
Yeah. And then it gets buried and then you get, sick or something that you really don't have to go through if you take the time to
Mm,
do the proper grieving.
mm. Yeah.
And I mean, it's been over 3 years now, and every once in a while, I still get knocked down. I feel like it's a tsunami wave hits, and it just, it just takes you, and it overcomes you. It comes out of the blue. You don't expect it, but you are a mess again. And so you have to sit with it again. And what I think is happening there is that as you clear certain things out of your system,
Yeah.
makes room for new stuff to arise. And so you're constantly dealing with these things, but not knowing when something will start coming up. So that makes it really difficult too. And I've found that most people who have lost something significant, that first year is really one of, like, brain fog can last a long time, and it's very difficult to get through. But when they get to the second year, all of a sudden they finally go, whoa, this
Mm,
is real. This is not going to change. And
mm,
that has to be dealt with.
mm.
So kind of all over again. And that's one reason why I keep my clients together. You need to be in a group. We don't heal alone. And I put them in like a mastermind group where they help each other through their transition into their new chapter of life. That's not available necessarily for these families, but there are groups that they can be involved with of people who have similar experiences where they can support one another. And I think it's really healthy to do that. As long
Mm.
as it doesn't become a poor me session.
Yeah, sometimes it's a self-pity section or
Yeah.
yeah, that's what you don't want it. So what's your advice for parents who are going through this process of grief in the sense of neurodiversity?
My advice is you really have to make a point of stopping and taking care of yourself. Keep in mind that if you're empty, you cannot care for the child in the way the child deserves to be cared for,
Yes.
which is hard because you have to put a stake in the sand and say, I have to stop doing blah, 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 blah,
Mm,
and take 10 minutes for myself. But it can be short periods, even if you close your eyes for a minute and take a trip to the beach or, something like that, that you imagine yourself being in a place where you're usually pretty calm, or you are thinking about how wonderful it is that you can do what you can do for your child instead
mm,
of always taking that negative perspective. Because you can see the dark cloud or you can see the silver lining. And it's a hard thing to transition, and I don't want anybody to be Pollyanna about it
Mm,
because there's nothing like that. It is a fact that you're dealing with, and it for I think for parents of neurodivergent children, it has to be so hard because you don't know what it's gonna be like. You can't
mm,
expect things to be the same as every other person, and then, child grows, there's these different stages, and children start to make fun of them or dislike them, or,
mm,
and you have to deal with that childhood meanness. You have to deal with the adults that can't accept it or handle with it. And you're there very vulnerable yourself.
exactly, exactly. And you're having to go through all that, which can be very difficult. So you work with a lot of parents, women, because your main work is working with widows who are facing loss.
Yeah, well, and high achieving women who are in executive positions, and they finally realize something's not there, something's lost, something's changed, and it doesn't fit them anymore.
Mm,
But the only way they know how to deal with it is to push harder.
yeah,
And I think that happens with parents too.
yeah.
I just push harder. I'll just work more. I'll just, and that doesn't work for us. So if you can find someone who can take your hand and walk you through this, that is really important.
Mm. You also help people address their self-limiting beliefs.
Yes.
And how does that present, and what are the consequences of continuing to have that
Well,
self-limiting
it
partner?
prevents in the manner of what a person tells themselves.
Mm,
Often it's not always out loud, but things like, well, if I was aware of this earlier, I could have prevented it, or it's my fault because I didn't do this. And I think a lot of people feel that way because it's so hard to understand why. So then they take it on themselves.
mm,
So that's guilt disguised as responsibility. And the sad thing about it is that it keeps the parents anchored in the past
mm,
and difficult now to act in the present. Think about all the things I could have done, I should have done. And there is a hint right there. Albert Ellis was a psychiatrist who kept saying, shoulds, oughts, musts, have tos are red flags that you are dealing with a self-limiting belief. So one of the things I do with my clients is when they say something like, well, here's a silly one. I had a client that said, my boyfriend doesn't love me because he doesn't call me every night. And I said, who says? You tell me you love me, but you don't call me. And she went, oh my gosh, and got it. So I think the thing
mm,
is, you have to catch yourself and ask, is this really true? The hard
mm,
part is being able to look at that in a non-judgmental manner.
mm,
So I think another one is thinking that their child's outcome depends entirely on them.
mm,
And they are not unconditionally totally responsible for what has happened and what the child has to face as they grow.
mm,
Some of that comes from the outside,
mm,
and, I think often there is this wanting anything for myself or doing something for myself is selfish. I just can't do this.
mm,
That is something that I think burns people out really quickly
mm.
because they deny themselves all the time.
And what you've said is so important. And that's why one of the things to start talking about early with parents, because I don't think people address that with them. So where after the diagnosis, it's go, 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 go. And for me, as a professional, I catch myself and say, actually, how many times have you stopped to look at that mother or that father and say, how are you? Because your focus is just on the child. So the focus is on the child, what is being done for the child. But how many times have we stopped to really find out about the well being of that parent?
Exactly, and I think parents are quick to judge themselves, looking around and saying, well, those parents are handling it better than I am. Well,
Yeah.
you know what? Comparison doesn't count because everyone's circumstance is different. The way people handle this is different.
Yes.
And you have to accept that you are doing the best that you can at this moment.
Mhm.
And that's one thing that I think family and physicians and any support need to keep saying to parents. You are doing everything that you can do right this moment. Tomorrow it could be different, but for
Yeah.
right now, you did everything that you could do.
And sometimes that's what the parents just need to hear.
Mhm.
Because, like you say, they're already so self critical of themselves that all they want to hear is that their support network is there for them rather than them feeling it's not happening. You also mentioned grief doesn't end. You said it echoes through generations. How does this look like for families navigating neurodiversity?
I think the sadness of this happening, it goes down in stories. It goes down in our DNA because it's become somatic, and we ourselves are reacting to things that our ancestors had to
Mm,
deal with. So I think that it's so important that we understand that it's very, very healthy for us to look at this in terms of what's best for me and what's best for the child and what's best for our family.
yeah,
'Cause including family is just huge.
yeah. Oh, wonderful, Lynn. So, for our families listening, because this podcast is listened to by lots of families who have neurodiverse children or people who know close family members or friends or even grandparents listening to this and professionals, clinicians listen, other people that are involved in the child's life and educators.
Mhm.
So what message would you want to give parents today who have gone through this process, which we recognize as grief? And what advice do you want to give if there's a parent just about to get a diagnosis, a parent who's just received a diagnosis? What's your advice for them?
Well, I have just done something that I hadn't thought about this in terms of this situation, but it probably would be very good for them. I've launched a membership platform that has experts who talk to all of the issues that people face when they're grieving, when they've lost something. They do workshops, master classes, all sorts of things like that. There's articles, there's interest groups, and then I've created a bunch of gamified tools that someone can use. So,
Mm,
for instance, if they wake up in the middle of the night and they're just beside themselves, just crying, and they can't stop and they can't nurture themselves, they can go in there and they could decide to listen to some soothing music, or they could do a meditation,
mm,
and they get step-by-step approach with that because it's AI driven.
mm,
So, and then it leaves them with here are 3 things that you can do right now
mm,
to start to move yourself out of the situation you're in.
mm,
And there's a free level, and I would love to have anybody. It's
mm,
at womenrisingtogether.org.
mm,
And, they can use those tools. Clinicians can send their patients or their parents there and make suggestions. It is there for people who are having difficulty, and there's no one they can talk to right now.
mm.
They might have a therapist, but it's not an appointment time, so you
Yeah.
can't get hold of them, or, something like that, and then they can choose deeper levels of work, but at least some basics to handle the immediate emergency they're feeling.
And I think that's quite good because these days when the mothers will have a lot of things to do or physical place they have to go to, having something that in their private time they can connect and do that and process things, I think it's quite good. So you've just launched it.
Just launched it, yeah, I think I only have about 30 members so far, and so it's being built out, and I'm gathering experts, and, if I get some people in that situation, I would love to have you be an expert on there because they do need someone who will help their group. You don't really lead it, you monitor it and ask questions,
Yeah.
but you can put your articles, all sorts of things on there
Yeah.
so there's even more people.
That's great. I would love to be part of it. Thank you for inviting me, Lynn.
Well, you're
Thank
very
you.
welcome. I'm so glad I thought of that as we were going along. Man, I
Thank you.
got
That's
somebody who might
really
help.
No, that's really good because I'm just looking at it as something that can benefit a lot of women because what you find is because of the lack of resources, there isn't a lot out there for people going through this process and families going through that process. There isn't much there. So actually, I think it's a great thing. You've given people the space to be able to get through these things without feeling pressured or
Yeah,
feeling,
no
yeah,
judgment. Yeah, nothing like
judgment. It's
that.
their own time. So it
And
sounds great.
I think we already even have a group for grandparents. How do your grandchild is having to deal with this. How can you support? We
That
haven't
is
gotten into the
very good.
family aspect of things.
That is very, very good. If we're trying to support a family, we need to support the network around them. And
Exactly.
sometimes they're forgotten.
I remember when I was, I don't know, maybe 9, my grandmother, who was like the quintessential grandmother with an apron and white hair and always baking and doing all that I absolutely adored her. She went in the hospital for just some routine tests and ended up getting hepatitis and dying.
Wow.
And, it was such a shock because she was like 56 or something.
Yeah.
And my mom, we had to go into Chicago, and my mom's sister was there. So they had us stay with the children, stay with Aunt Beth. And I was just so distraught. I was lying on the couch just crying because I knew I would never see her again.
Yeah.
And Aunt Beth came in and she said, "Stop crying. Go out and play with the children." Which was the worst thing. I mean, here I am at my age, still remembering this, it's very visible. We were never taught what to do, how to say things. And my parents thought they were doing the best thing. They thought, well, they're too young to go to a funeral. You've got to talk through all of those things.
Yeah. And like you said, there you were, but you still remember it how many years later, very vividly. So it did have an impact on you.
Huge impact.
Yeah.
And I know she wasn't being mean. She just didn't
She
want
was
me in
just
there
do-
crying.
she was just doing what she thought was the best. And if we think about that era, people didn't really sit down to process things a lot. They just got on and did it. Yeah.
No, and people weren't, their emotions weren't out in the air very much. Nobody
Yeah,
knew how to
exactly.
deal with it. So
Yeah, exactly. Exactly. Oh, this has been awesome. And Lynn, I really respect you and for all the things that you've done,
well, thank you.
and going through that trauma and being able to come out with so much good and helping other people going through this process. It's just amazing. Well done. I'm really inspired. I tell myself I can't get tired. I have to keep going.
I know. Yeah. Yeah. And it's time women got back to that mindset of supporting each other. It used to be that maybe they were on a farm or something and they'd get together to bake or they'd get together to quilt or and they'd talk about
Yeah.
things. That doesn't happen anymore.
Yes. We really need to get back to those times.
Yeah,
I think the world just moves so fast and
it does.
we left things that were quite valuable behind. So yes, thank you for setting up those groups. It's just great. Yeah. So where can our guest find you?
They can go to womenrisingtogether.org, and that's that platform which they can check out, but they can also learn some other stuff about how to get in touch with me. But I also post almost daily on LinkedIn and Facebook.
Oh, do you?
Yeah, yeah.
Oh,
I just have
wow.
2 really interesting articles out now about I got excited about watching these little reels on gorillas and gorilla life,
Yeah.
but they are so gentle and kind. What can
Well,
we learn from them? What have we forgotten? And
yeah,
so there are 2 articles on there that people have just they're just loving it. So, I think that those kinds of things really teach us a lot. What can we
yes,
learn from somebody else,
yes,
another culture, whatever?
absolutely. I think that's what we need to get back to, that support for each other, because a lot of people are having to go through these journeys. And if you think about parents of children with neurodiversity, the minute they've got that diagnosis, some of them retreat, they go inwards. They don't come out, they don't go to the places they used to go to. They live a different life, and
That's right.
that can be quite isolating.
It
So
is.
it is good that there's hope for helping people go through that process and come out of themselves and find a new hope, something new that they would like to
That's
do.
right. That's
Yeah.
right. And
Oh,
you can do that
yeah.
when you take the time to really get in touch with yourself and what you have enjoyed when you've been in flow, for instance.
Yes.
Tap into that stuff because you can create something out of it.
Yeah. Oh, this has been a fantastic episode. I have been very inspired. Thank you very much.
Thank you.
And I have to go and double up my energy now.
Well, I will get in touch with you about the
Yeah.
platform and let you know what that entails. And
Okay.
this has been great. I'm so glad that we got together because hopefully we've given
Yeah.
somebody else a little bit of juice to keep going.
Yes, definitely. I think people will be inspired by you. So thank you so much for all that you continue to do. I truly appreciate it and look forward to connecting and supporting your work.
Well, thank you. Thank you. And likewise, for sure.
Oh, thank you. Thank you.